So what family-centered care means to me is developing a mutually respectful relationship, open communication, and decision-making that is best for the child and the family, incorporating their knowledge, incorporating my knowledge, and putting those things together.
Family-centered care to me means involving the family in any way I can and any way they want to be. So don't just assume that they want to do everything for their child.
Seeing family-centered care in action every day here. As I walk through the hospital, I see so many wonderful examples of how we work with families. But while we're in the hospital, we need to work together for the healing and the safety of that child, and to have that communication together about what that's going to look like during that stay. I think that's a really important part of the message that I'd like to get to everyone today.
Since we started coming, the term family-centered care has been talked about a lot. You hear it kind of everywhere you go. When we first started, we didn't really know kind of what it meant. We'd heard it, but didn't know. Being here as much as we had, we get it. They don't really just care about the patient. They make sure that the family's okay.
I always like my Nana being there overnight.
I think it's very important to have your family included in your care, because when you're taken out of your everyday life and brought to the hospital, it can be quite intimidating.
9 times out of 10 I have been able to ask the questions that I would like, because usually all the doctors and nurses try to involve the whole family in the conversation rather than just the patient and the parent. Even if you're a parent, you don't always understand all the big fancy medical words that they all use. So they try and use words that everyone in the family can understand.
Because we do family-centered care here at the Children's Hospital, I think it's really important to explain to families what that means and what that means for them. Again, it can look very different. It doesn't mean that they have to direct all the care. It doesn't mean that they have to make all the decisions on their own. It doesn't mean that we're going to make all the decisions on our own. But really to help families appreciate that it's a partnership and that everybody's input is very valuable.
So it's not just caring for the child, it's caring for the whole family, because whatever the child is dealing with is impacting everybody within the family, so it's kind of nice to know that we're all being taken care of.
Well, because I'm not an adult, including me in the decision making, or as well letting you know what's going on and thinking of you as a person, not just your chest or your knee or whatever they're treating.
There was this one neurologist that I went to see for a while, and I really liked going to see her because she was the first doctor who actually spoke to me. She talked to me and asked me how I was feeling and what my goal was, where I wanted to see myself in the future. And she actually sat on a little tiny chair and talked up to me, and it was a cool feeling because you feel like you're equal instead of feeling like I always felt like doctors were talking down to me, or I wasn't part of what was happening. So I really appreciated that experience.
I think the first time I meet families, and as I see them thereafter in follow-up, is to put their concerns at the forefront of the interview and of the appointment. And I think by actively addressing their concerns first, making that the most important part of the clinic visit, you immediately establish trust, because they definitely know right away that you're willing to listen. What is important to them is important to you and to the rest of the treatment team.
What we know about Cameron is important, and it's heard. We know him the best, and I think that each child individually and each family individually is treated like they're important and they matter.
You lose a lot of control, if you will, and you could feel like less of a parent. They are very supportive in allowing us to do as much as we can do. Yes, there are things that they need to come in and do. She's in a hospital. But when she was a baby, we fed her, we changed her, we did all that, because I still needed to feel like a mom, and they were very supportive of that.
It is incumbent upon us to make sure that families feel comfortable communicating with us. and involving families in that communication.
I think the family plays a very key role in family-centered care, specifically with sharing those concerns and speaking up when those concerns arise.
Initially, you know, I think in any situation you're a little bit maybe timid to speak up, but as everyone made me feel so comfortable, I spoke up.
I have now learned that I have a voice. In the beginning, I kind of deferred to everything they were saying because I didn't really know a lot. I've now learned I have a voice, and I do know her better than anybody. And so if they're saying one thing, I'm like, that's not what's going on. I will speak up, and I know that they'll listen, so that's good.
You know, it is very simple things, making eye contact, knowing the child's name, knowing the family members' names, sitting down with them, taking the time, not looking rushed, not feeling rushed, exploring things that maybe you didn't think about. If a family asks you a question about a direction of care that maybe you didn't consider, and really taking that away and looking at that option as a viable option. I think it's just showing respect for families, just like you would in any relationship that you're creating with another person.
In my experience, building the relationship with the child brings the trust in the relationship with the parents.
Usually first thing in the morning, when I come in on shift, I introduce myself and I say, is there anything I can get you before we start the day? Or how was your night? And just try and interact with them just on a personal level and not say, okay, we need to do this, and give them a checklist. So I just try and offer my help.
You know, making sure that when you're introduced and you make sure that you know the family's names and the children's names and use them. And check in ongoing with families and children, even if it's just to, you know, just a quick head in the doorway, how's everything going?
And I know that sometimes we have a very diverse and multicultural community, so it's important to use people like interpreters and other family members to ensure that you really understand the values that that the family brings, because they may be very different from the ones that we have.
We make assumptions about what a family is, and I see a mom and my patient and then his sister in the clinic, and I just assume, well, you're a typical family of 4, and this is the mom, and this is your son. And sometimes we miss the boat on that. We don't realize that this is a step parent or a guardian, or we always get there eventually because we have to ask those questions. But sometimes we kind of miss the whole family issue right off the top.
That's at the heart of what family-centered care really is understanding where families are coming from, understanding what they're going through and what they're dealing with, and trying to do very simple things that are just respectful, collaborative, to make this journey a little bit easier.
One of the ladies on the floor comes in and stalks everything. She'd come in every morning and sing to Sienna, sing good morning to her every morning, and that was huge. It just was a nice, bright way to start the day.
One very important thing for me is that I had Amanda's voice on a video. And one of the people here works in the computer department. He saved the voice from an actual video and put it for me on my phone as a ringer. And I wake up on her voice every day, which it makes me want to start my day. Well, if I was to tell a kid that was just coming to the hospital, I would say that don't be afraid to ask questions.
Family-centered care takes into account what's best for the families, what's best for the child, but also allows us as physicians and care providers and staff to provide the best care for those families.
It takes everybody. It's not just me being positive, it's not just the nurse he has, it is everybody, right down to the person in the cafeteria when I'm buying lunch.